Hello, and welcome to another of our series in the Conversations with Pathologists. I'm Dr. Louis Hassel, and my guest today is Dr. Walter Kelley. He is the medical director of the Red Cross Blood Services in Salt Lake City, Utah. And we first crossed paths when he was the medical director at the Oklahoma Blood Institute near where I practice. Prior to that, he did his training at the National Institutes of Health, and I don't know exactly what got you into pathology, Walter, but why don't you take it from there and tell us a little bit about your background?
Yeah, absolutely. So pathology is, and specifically transfusion medicine as a subspecialty within pathology is a really interesting field. And for me, it's something that I've actually been building towards essentially my whole life. So my best friend, as I was being raised in Hawaii, actually contracted HIV from blood products. He had hemophilia.
Wow.
And so I literally was then decades later trained by the physicians who treated him at the NIH. So it really sort of came full circle for me. In the interim, I got a bachelor's degree from the College of Agriculture at the University of Florida, which doesn't make sense to a whole lot of people until you begin to understand that blood is governed by the US Food and Drug Administration. And guess what? The same rules that apply to food apply to drugs. And so I spent 4 years at the University of Florida sort of learning to understand how the FDA works. I learned about nutrition and agriculture and other things too. But there ends up being a whole lot of manufacturing and logistics in the world of blood, and I get to do all of that stuff. So it really is pretty great.
Yeah, you have patient contact, and you have inspection issues and these regulatory issues, and so it is really a very interesting hybrid of things.
Yeah, it really is quite. It is not what most people think of as pathology.
Yeah. And you really kind of knew when you started medical school that you were heading towards something related to blood banking?
Yeah, so that was my sort of my tack from the beginning, and I did very briefly consider obstetrics and gynecology. I was able to do I had several general obstetric rotations that were wonderful, and then spent a month at the Mayo Clinic doing gynecologic oncology and pelvic floor reconstruction, which was amazing and wonderful. And I happened to have my first son while I was in medical school, and the OBGYN who delivered him there in Arizona said to me, "Walter, I really don't think you're strong enough to be an obstetrician." And I said, "You might be right, because I mean, really, there's some physical strength that goes into some of those complex surgeries and things." But anyway,
Well, it's nice to have helpful inputs along the way.
yes.
So what are some of the day-to-day challenges? Describe a typical day for a blood banker, in your kind of a position at a blood center.
Yeah, so it's fascinating because so as you mentioned, I was the medical director at the Oklahoma Blood Institute there in Oklahoma City for a number of years, and there I sort of had everything in one place. So OBI covers some geography, but they're mostly Oklahoma, North Texas, a bit of Arkansas, a little bit of Missouri. But with the Red Cross, I'm on any given day, I'm occasionally responsible for most of the landmass of America, and so I literally my phone is always there, uh, and so for me, my day starts quite early. One of my roles is that I'm the principal investigator, so I do research. I'm the principal investigator for our cell therapy program. And so I have research participants that start procedures at 7 a.m. on the East Coast in Philadelphia and in Atlanta. And so I start getting phone calls, for my time, I'm in Mountain Time. I start getting phone calls for that. Those are just sort of normal things, at about 6 in the morning. And then I have those research participants going all the way until I have them on the West Coast as well, in Portland and in Southern California. And so I get calls from those until about 9 o'clock at night, my time. So it's a lot of answering questions. And then I do the same thing for the blood services side. So I'll get questions from everything from on-the-job trained phlebotomists calling me and saying, is this donor okay to donate blood? And then, everything from that up to, a neurosurgeon calling and saying, "I don't understand how to make this person stop bleeding that I'm about to cut their head open." any thoughts on that? And literally everything in between. So it really is quite a bit of fun.
Yeah, you're dealing with a lot of different kinds of problems and different types of people
Yeah.
and so forth. Um, what gives you the greatest joy in that process? What really lights your your dopamine receptors, I guess, is the
Yeah.
common parlance.
So I think a big part of it is the variety. So I absolutely love. I don't get to see patients very often in person. I do occasionally get to do that. But I love that occasion when I get to actually go in and affect someone's care in that very direct way. On the other on the far opposite end of that, I really enjoy the process of science, and so I enjoy designing experimentation. I enjoy the process of writing manuscripts and working collaboratively with groups of people around the world, to do things like that. And it really is that, I think, that variety more than anything that that really keeps me charged. I think um, if I were a dermatopathologist looking at slides all day long, um, I couldn't do it. They're really cool. They're really
500 basal
fascinating.
cells later, you're kind of going, okay.
Yeah, it's amazingly fascinating for about 20 minutes. And then it's like, oh, wow, that stack of slides is really tall. For sure.
Well, one of the things that has always struck me about transfusion medicine, and I enjoy it very much too, because it is that interface between both the public
Mhm.
as well as the patient, because it is probably the most therapeutic component of pathology, where
Yeah.
you're actually giving the therapy. And I think you had a particular involvement with one of the more recent examples in the COVID-19 plasma issues.
Yeah. Yeah, absolutely. So transfusion medicine is sort of nice because as a pathologist, I get to make the diagnosis, and I also get to administer the treatment. And that's pretty uncommon. It is pretty great to be able to do that, for patients with a number of wide-ranging diseases. But like you say, the public interface part is really quite a lot of fun. And so you get to deal with both the policy issues of how you make blood products available, and then the actual logistics of how you get them to where the hospitals are. And of course, it's not that I do this by myself. There's a giant team of people working together to do it. But playing a part as a transfusion physician is quite nice, to be able to do that. So right now with the current pandemic, one of the treatments that's being investigated is actually collecting plasma from people that have recovered from the virus and then administering that plasma to people that are ill, or prophylactically, actually, to prevent people with exposures from even getting it. And it's been wonderful, to be able to be part of that.
Yeah. Well, so, as you know, I had a little bit of background in blood banking from a very earlier stage, maybe an earlier pandemic, if you will, in the post-HIV era.
Yeah.
And this was the one instance in my professional career when the news media was actually interested in talking to me. So is that something that makes you nervous, or is that something that you enjoy?
I think it's tremendous fun. I actually, this is, I think, super important for the students that are watching this. Your CV becomes your record of the stuff you've done. And a friend of mine pointed out, she said, Walter, you're not keeping track of all of these media appearances. You need to add that as a section within your CV. And so I actually did. And so, yeah, I've been able to do television, radio, podcasts, print media. And it really is it's a lot of fun, trying to engage the public in that very media centric way. Unfortunately, it also lifts the curtain, for those of you that have never done performance work. I was a musician. I actually played in an orchestra back in Oklahoma, which was a lot of fun. I don't unfortunately get to do that here. But once you've seen sort of how the sausage gets made, to use a food analogy, because we're pathologists, you begin to understand that it is not quite so clear. but it is. It's a tremendous amount of fun to get to interact with the media, and like you say, many of them are very supportive, which is a wonderful thing.
Yeah, that is a really interesting part of the challenge. Well, So, how has pathology and your career as a blood banker influenced the rest of your life? What do you do to balance out these long days and to relax or relieve stress and those kinds of things in your life?
So I'm curious, can you make it so that I can share my screen? Because I have a picture that I think explains that better than words ever could. You might not be able to. Just
Okay,
depends
well,
on.
let's see. I thought I'd allowed you to share screen, so you should be able to.
Let's. All right, I'll try it. Let me get to the
Okay.
slide. Um, Here you go.
Yeah,
Let's see.
technology is our friend now here.
Yeah, it's wonderful. Let's see if it'll let me share the screen now. Yeah, here we go.
It really builds the anticipation too when you.
So there you go. So that's me literally taking call from my hot tub with the beautiful Rocky Mountains in the background. I'm literally taking call on my Apple Watch.
I
Um,
love it. I love it, Walter. This is the pathologist at work.
it really is. And then you'll hear these stories about this, but here's the reality. This is me. I kid you not. This is me presenting at an international infectious disease conference. Really, seriously. Because of COVID, we had to do some deep cleaning in a building, and so I literally just had to find a space that I could set up. So the wall behind me, it looks perfectly like a nice little wall, but this is literally space that was under construction, but it was safe and clean.
Yeah, talk about sausage being made. This is it right
Yes,
here.
it really is true. But yeah, it's you ask what makes it all worthwhile, and I'll tell you, it's the people that I work with. This is me and two of my nurses pre-COVID, preparing the first FDA-approved cell therapy, genetically modified gene treatment for lymphoma, administered at LDS Hospital in Salt Lake City. This is my tiniest patient here in Utah, having a treatment called photopheresis. Yes, her mom has given me permission to share her picture. She wants me to share it as often as I can because she's so cute. But yeah, and the hot tub does help. But
Oh, those are great shots, and I really appreciate that that you've got that balance of the patient at the end of it. But before we go to kind of your remarks or advice for pathologists
sure, yeah,
prospective pathologists that now are going to be looking
yeah,
forward to their hot tub days, a lot of people in society sort of look at regulatory bodies, accrediting agencies like the FDA or like other CLIA or other CAP accreditation issues as kind of the boogeyman, if you will. The intransigent, this is what the letter says and you haven't dotted that I, so you're going to get cited.
Yeah.
Tell me how your experience has been with those circumstances.
Yeah. So
have they been stressful or actually positive?
yeah, so I actually take the complete opposite view. I'm sure part of that's my bias. So I was trained at the FDA. When I was a clinical fellow at the NIH, some of my attending physicians were commissioned corps officers in the U.S. Public Health Service that were assigned to the FDA, and so I was trained by them, and so I view all of these inspections, and I undergo a lot of them. Just before you and I got on, I was actually on a video meeting. I'm one of the bone marrow transplant directors at LDS Hospital, and we have a quarterly quality meeting, and we were actually discussing how we were going to respond to some of the findings in our accreditation inspection that was done by FACT, the group that accredits cellular therapy programs. And again, I really view that interaction as how to make things better. So my belief is that regulations exist for a good reason, which is to keep people safe.
Yeah.
And so when I back when I was at a place that was CAP accredited, I used to be a CAP inspector, and enjoyed doing that and learning through that process of performing inspections. And it's the same thing now as my various laboratories are inspected. whether it's the FDA or state agencies or other people, I really have always viewed it as an opportunity to learn and as a very positive thing. So it's not something that I'm overly concerned about. And honestly, I'll give my father credit for that. He retired as a lieutenant colonel in the Air Force. He was a dentist, but he spent most of his time as a lot of his time as a hospital commander. And he really did. He viewed the preparation of preparing for the inspection and then the process of going through the inspection. It was all, he talked about it at home, and it was very much a how do we make this the best we can, for our airmen, and I view it as the same way now.
Yeah. So in contrast to the public notion of I'm from the IRS and I'm here to help, this really is there is no double entendre with that. I agree. I think these people do come to help, and if we look at it that way, we get a lot of benefit out of it.
Well, we sort of get the best of both worlds, because the FDA is a law enforcement agency. They have badges. A couple of them even have guns. Very few. But they do. But they're a law enforcement agency. But they're really the only law enforcement agency that tells you beforehand, this is what we think.
Yeah.
And then all you have to do is do it.
Yeah.
Shouldn't be that hard. Sometimes it is.
Well, so what's your advice for someone who's thinking about pathology or even thinking about transfusion medicine?
Yeah, sure. So there's a few things. So the first thing is that it's not all microscopes, although microscopes are good. Microscopes are good. So, one of the biggest things that I see as an advantage to pathology is, you can live almost anywhere. I have friends that are pathologists in very small towns, and I'm talking like very small, like 15-bed hospital kind of thing, and you can live in large urban areas. You can practice in academic settings. You can practice in community settings. You can have hybrids of both. And so there really is a lot of advantage to that. It's one of the few specialties and even subspecialties that still has a lot of geographic ability in terms of where they go and what they do. But I think, you can have a lot of fun with science, and a lot of people going into medical school liked science. That's how they got there, is by doing well in science classes. I have an academic appointment at the University of Arizona in Tucson, and I actually interview prospective medical students, and they like science. And pathology really lets you be very directly involved with science, but you also get to have fun with logistics, right? I literally work with the folks to make sure that we have enough juice at the blood drives, and so there is there is this huge breadth of interest in what you can do, but in the end, you can make a difference. I happen to work for the largest blood center in America, which is the American Red Cross, and we do a lot of things other than blood. This is me and my boys getting ready to go put up smoke alarms to help prevent home fires, which is another thing the Red Cross happens to do. But these kind of opportunities for engagement, really exist within pathology in a way that many people don't necessarily think of, because they think you're in the box. And pathologists definitely don't always stay in the box. If you like the box, it's good. You can stay there. We need pathologists in the box, but certainly there are a lot of opportunities that may not be readily apparent to someone initially looking at it.
Well, Walter, very well spoken. I think you've epitomized the kind of outward-focused, public interacting, patient interacting pathologist that many people don't get to see very often, and I really appreciate that. And I think our students and audience will likewise appreciate the good that you're doing, both in your family as well as in the broader community from coast to coast, and who knows, probably also the world, with some of the groundbreaking treatments that you guys have pioneered and begun to validate and test. So thank you so much for joining us today. And if people have comments, they can always add the comments to the video, and we can loop back with them as we're able to do that. So until next time, thanks for joining us on this Conversations with Pathologists.